Everyone, my name is Robert Greener. I'm a physician assistant and a graduate student at the Dreven School of Education at the University of the Incarnate Word. I'm here today to talk about why we should use community-based participatory research as a tool to advocate for patients. But first off, we need to talk about how we can use community-based participatory research in the healthcare system. The CBPR system provides a tool for us to refocus our healthcare reform efforts. And reform is needed because the cost of our current healthcare system has created a large push for multiple ways to reform this system. Medicaid provides a good illustration of this reform, as the high cost of Medicaid is overwhelming the budgets of states. This creates an impetus for change in the Medicaid system, and one of these reforms is the inclusion of the medical home model. Now, the medical home model is a comprehensive, patient-centered focus which looks at the use of preventative and primary care to increase access, increase communication, and increase quality while decreasing cost. This is done using a healthcare team which may include physicians and other providers, nurses, dietitians, pharmacists, social workers, and other clinicians, with the ultimate goal to decrease cost while improving quality, increase the breadth of care through better advocating for our patients using this team model. Now, a concrete example of the medical home model started after the 2010 Patient Protection and Affordable Care Act, which contained various provisions to support the implementation of the medical home model. As a result of this act, community health centers, or CHCSs, have been created, which are community-based, nonprofit organizations that provide comprehensive healthcare services. People who lack access to medical care, which includes uninsured residents, those of rural or underserved areas, and some Medicaid patients, are provided care regardless of their ability to pay. In addition to primary care, community health centers often provide dental, vision, and behavioral health services using a community-centered model and integration of care. They often also include healthcare education and case management. As of 2010, there were 1,124 community health centers, which operated in more than 8,000 healthcare delivery sites and served more than 200 million patients. So who can be a patient advocate? We tend to think of clinicians as patient advocates, such as physicians, other providers, nurses, and social workers. But we also need to think about other community members, other community organizations, NGOs, and other professional advocacy groups. In actuality, anyone who has the desire to empower patients, such as family members, can be considered a patient advocate. So why would we use the community-based participatory model as a tool to advocate for patients? Community-based participatory research has developed greatly over the last 20 years as research funding organizations have realized their value. In the beginning, community-based participatory research often just included the community to influence the study. But as the community-based participatory research model has matured, it has increased the effectiveness of the community and truly bring them into the study so that they advocate for all aspects of the study and become involved into the study. And it's an ongoing process. So in the beginning of creating a CBPR research study, the ethical principles are agreed on by the community and the researchers. The community also sets the guidelines for safety and how to handle conflicts and other difficulties. Even the aims and objectives of the research are actually created collectively with the community. And this creates a unified vision so that the methods to implement these goals are developed collaboratively with the community in mind. Even during the research process, the management of the research involves community members. And when funding decisions are being made, it's actually the community who advocates for how to allocate the money. If there's training needs to be able to create the research, the training needs are decided and implemented through the community. Ultimately, it's the community who determines the roles of each person involved in the study, and therefore the community is actually a vital member of the research team. During the initial rounds of the CBR, community-based participatory research, there is cycles of reflection, evaluation, and learning, so that the community becomes not just a participant, but an actual driver of the research. And this is why the community-based participatory research model is the best to achieve the goals of improving the healthcare system, because it involves the community in every aspect of the research, so that the research is driven by actual needs. It helps better identify the needs of the patients and better study them in every aspect of the research. Generally, research in the traditional model is done with the researchers driving the research. However, in community-based participatory research, the research doesn't end until the needs are met. And generally, in community-based participatory research, the model really emphasizes the need to build ongoing and long-lasting partnerships rather than a simple study with a clear end date. Community-based participatory research is much more adaptable than traditional research, because it involves everyone into the study, and the study evolves over time. Through cycles of self-reflection and self-correction, the research becomes more and more effective. Not only that, but community-based participatory research brings in not just the community, but other professional organizations into one partnership that will come to better decisions, because all knowledge is brought into the research study. And it breaks down the power imbalances that are in the traditional healthcare system, where clinicians are seen as experts and patients are the passive receivers of information, because in the community-based participatory research model, everyone is considered an expert in themselves, and every knowledge is considered valuable. And patients bring a knowledge that is often not honored in traditional research models, as they are empowered by this style of research. And it naturally increases the feedback of the value of whatever community-based participatory research is studying in continuous loops to continuously improve. This type of model is particularly important when we talk about marginalized populations who are historically low utilizers of the healthcare system. America is built on a diverse group of people with diverse needs, and it has been shown that the segments of the population that most need the care are historically low users of the care. The healthcare system is somewhat monolithic, and it does not adapt to the needs of local community members. Community-based participatory research helps make healthcare more adaptive and figures out the real needs of our diverse community and how best to meet those needs. This is a research model which values the knowledge of all groups, to include those marginalized in this diverse community that is America. Finally, when the knowledge is gained in the community-based participatory research model, it is shared with everyone involved and not published in an article that only other scholars will read. The community actually is credited for the results of the research, and this is another further advocating for the importance of their knowledge. We're also empowering organizations in their community because we're bringing them into the system. So thank you for listening to this talk today. Here is some of the references that I used in case you are interested in learning more about this subject.